Lots to talk about. I want to talk about this Eli Crane, Republican representative from Arizona, evidently is introducing a resolution to award the Congressional Gold Medal to this Daniel Penny guy. And you may remember this Daniel Penny guy intervened on a subway car loaded with commuters where somebody, acting the fool, threatening people, claiming, saying someone's going to die. This person intervened, protected a woman and a child, and look, laudable, absolutely, good Samaritan. I think, judging from the video, maybe a bit too far, but I'm going to always side on the side of someone being the good Samaritan, and unfortunate things can happen. The person that he was subduing died in the process, and I know there was a huge uproar, all kind of stuff. I don't think this guy should have been brought to trial for what happened. Just my view, but I do find it interesting that the politicization of this situation and the shooting of the CEO, and how people have viewed it very differently. Because look, if the goal was to protect innocent life, to protect that mother and a child from someone who was making threats, or as I believe, and I've had a lot of people who have agreed with me, that a system that is going to cost hundreds of people their lives today and probably another hundred or more tomorrow, that there should be some discussion. Look, I don't think the Congressional Gold Medal should go to this person. A lot of good Samaritans do a lot of great things. My wife, for instance, was involved in an accident. There was a good Samaritan who came and saved her life. I would love to put her up for the Congressional Gold Medal, and I'm sure a lot of people would as well. But I look at this moment as an opportunity. Now, understand, I don't condone the killing of anyone. I don't condone violence at all. But I do understand it. And this is where my position has always been. I can't condemn it because I understand it. I understand the feeling. I don't condone it. And I think there's a strong position there. Because out of this CEO being killed, potentially thousands of lives might be saved by the fact that we've raised the awareness that this United Health Group denies almost a third of the claims that come in. And we know that people are going to die from that. We know those denials are going to delay care. We know that repeated denials will delay care even further. And a lot of people who are, especially seniors who are up in years, they don't have the time to be able to go through a whole lengthy, in a lot of cases, not even the ability to go through a lengthy appeals process. So by raising this awareness, we can fix a lot of this stuff. So for me, the benefit is not killing the CEO, and I think it's tragic. But out of this tragedy could come an opportunity for us to use this in a way to ensure that it doesn't happen again. And not by more bodyguards and not by more restrictive behavior and all of that, but by, oh, I don't know, solving the potential reason for it. And look, at this point, we're still guessing. And I may be proven wrong down the road. But the fact of the matter is, we do know these denials lead to deaths. We do know that we can and should do something about it, especially as we are privatizing Medicare. And I go back to this Medicare Prescription Drug Improvement and Modernization Act, the Medicare Modernization Act of 2003, that opened this door to privatization, that opened this window to these profitable companies taking over our Medicare and, well, using their bag of tricks of denial, delay, depose to stop care from happening. And as I've said, Medicare was that promise to seniors that you're going to get health care. When they passed this in 2003, they opened up a door. They gave a huge sales point to these private plans. You can negotiate for lower price drugs. Medicare, we're not going to allow them. In fact, Medicare, you're going to pay full price. The poison pill was in the bill. And we're now going to be, in these next 4 years under Trump, in a situation where Medicare as we knew it is gone. It's now going to be privatized health insurance, just like working people get. And it's going to come with all of the denials, all of the gridlock, all of the delays, all of the narrow networks. And it's going to cost lives. It's that simple. It is that simple in my view. So I look at this tragedy as an opportunity. I look at it as an opportunity to go, hey, why did this happen? You know, the interesting thing to me is the guy on the subway. I don't hear anybody asking why that person was deranged or whatever word, out of his mind, or whatever you want to hear. I don't hear anyone saying societally, how do we fix those problems? I think there's an opportunity here to fix a massive problem. And that is, in my view, stopping the privatization of Medicare and talking about what kind of health care, what kind of health insurance system we should have to get us the best care that we can get. We pay the most money. We should get the best care. Is this going to be that tragedy that raises that bar of awareness that gets us to go, hey, we can do better. We should do better. We must do better. Is that possible? I don't know, but I'm hoping. And as I've had a lot of people tell me, Rick, the answer is single payer. The answer is, public health care. And I agree. This should be the battle cry in this moment. Instead, the privateers, the profiteers, the CEO class, they're just looking for revenge. Still not going to get you better health care.